like the order of how bowel moves, okay? All right, y'all lost. And we know that in order for it to move, it has to contract, right? So your intestines are contracted. So when we have cramps, especially like when we have diarrhea, it's because our intestines are cramping like super hard and a lot. All right, so nausea and vomiting, we're gonna talk about that first, right? Y'all don't need like the definition of nausea and vomiting, you know what it is, right? One, you feel like you're gonna throw up, one, you're actually throwing up, okay? So we have several different types of antiemetic drugs. We have phenothiazines, that contains like a medication, promethazine or phenergan. Y'all heard of that, right? So a lot of times they sell that on the street, promethazine and codeine. They mix it together and sell it on the street. Okay? Yes. So the sad thing is, both of those cause severe drowsiness and also a drop in your blood pressure.
And death later, because a lot of people have died from.
Yes, because the blood pressure drops too low. Okay? You got anticholinergics. We talked about that already, right? Anticholinergics make you do what? Make you dry. So if you feel like that sick feeling, then we can use anticholinergics, especially for like motion sickness. Like if we on the boat or something like that, we can take like a scopolamine patch, put it behind our ear, and it'll help. Antihistamines. Cause drowsiness as well. They have that drying effect as well. So promethazine is considered an antihistamine as well as a phenothiazine. It's in both of those categories. Okay. Then we have 5-HT receptor antagonist and dopamine receptor agonist. So I'm going to exit out of here and go to your book, because your book has like a little, your book has like a little chart that talks about the different medications. So I wanted to go to that chart to show you exactly what medications I want you to be looking at. Okay. Can everybody see this chart? FYI, it's on page 359 in your book. Okay? So the medications that I definitely want you to know is meclizine. Right, y'all heard of that medication, meclizine?
Nope.
So meclizine, a lot of times they give it for nausea and vomiting. They can also give it when you have a lot of anxiety because it's gonna calm you down, make you drowsy. They can, huh? Yes, it does, yes. They can give it for that as well. All right. Metoclopramide or Reglan, I do want you to know that as well, okay? A lot of time with Reglan, it helps with like that delayed gastric emptying, all right? So it's not somebody who has like a whole lot of vomiting, they have more nausea than anything. And it's because like the food is just kind of sitting there, okay? Compazine, y'all heard of compazine before, yes?
Yes.
Okay, has the same, and you'll notice with all of these medications for nausea, the majority of them have what type of side effect?
Dizziness.
Drowsiness and dizziness, okay? Promethazine, this is something that we give often, especially in the hospital, especially if they have like pneumonia as well, all right? We usually give it with codeine. So promethazine and codeine, we usually give it at the hospital, but at the hospital it's more controlled, right? Not like they do it on the street.
Look, my baby, when he has he has bronchitis, so they give him promethazine, but his is green.
Yeah.
Why is it green?
It just
That's the
depends
children.
on what manufacturer they use.
Because they have
So
different
it's not like
colors.
the same as the purple one then?
It's the same, it's just,
Whatever manufacturer's filling it.
Because they got red, yellow, green, purple.
and it determines like, is it a syrup or is it an elixir? All right, so it just depends on how they make it, okay? Because if it's an elixir, it has what in it?
Alcohol.
Alcohol. If it's a syrup, syrups are good for what type of patients?
Children,
And
older.
why?
It's
Easier to take, thicker, sweeter.
Thicker, sweeter, it's easier to swallow, okay? So all that plays a factor. Then there's ondansetron, okay? A lot of times, this is what they'll give to pregnant women, or people who have nausea and vomiting from chemo.
That's a strong little pill.
It is, then it's also, you can use a sublingual one as well, comes in sublingual form, okay? Scopolamine, we talked about that, right? What type of medication is that? What class is that in?
Mean.
I know it's for something for respiratory.
It's an anticholinergic. Remember I said the patch that you put behind the ear?
Oh.
That's what
Oh,
that
yeah,
is.
that's right.
Mhm.
For the
Scopolamine
mucus,
patch.
to dry the mucus up.
Correct. Okay? So those are the ones that I really want y'all to know. Okay? The main ones that are gonna give you drowsiness are meclizine, Reglan, Compazine. Well, Compazine is not a whole lot of drowsiness, but it is a lot of dizziness. But sometimes when people are dizzy, they kind of have that kind of drowsy feeling as well, that drunk feeling as well. Phenergan, definitely. Promethazine or Phenergan, definitely they're gonna have a lot of drowsiness, dizziness, because it's going to drop their blood pressure, okay? The blood pressure is going to drop significantly as well as their pulse, okay? Ondansetron, again, is really good for pregnant people and those who have like medication-induced nausea and vomiting, okay? Notice that it does not cause a lot of dizziness and drowsiness, okay? Which would be good for somebody who is pregnant, right? Scopolamine, again, is really good for those who have nausea and vomiting from motion sickness, okay? If you wanna go on a cruise, but you know that the rocking of the boat's gonna make you seasick, put that patch behind your ear, and it's good for 72 hours. So every 3 days, you just change the patch. Make sense? Questions?
Jeanette.
So there's some additional things you need to know when you would give a medication for nausea and vomiting as well,
Your card.
alright? Usually when somebody has nausea and vomiting, they're
Jeanette,
real
your
sensitive
debit
to
card.
smells, right? So if you have a patient that has nausea and vomiting, are you gonna wear like a lot of lotion?
No.
I mean, if you're gonna wear non-scented. It should be light scented because they can smell anything. So non-scented lotion, okay? Even sometimes deodorant, if the deodorant is strong, then sometimes that'll trigger, nausea and vomiting, okay? Also, foul odors, okay? So if, let's say that you don't wear deodorant, and it's a hot day, and you're going in, you're taking care of all these patients, just know that strong odors, even light odors, will cause them to vomit, okay? Another thing with people who have nausea and vomiting, we also encourage frequent mouth care. Why do you think?
Dry mouth.
A lot of times they have dry mouth. These medications can cause dry mouth. What else? You ever been sick and just didn't feel good and like the yucky taste in your mouth kind of made you even sicker?
Mhm.
But like if you keep their mouth clean and fresh, they're less likely to have a lot of nausea and vomiting. Make sense? Alright, let me go back here. Alright. So each of these medications works differently, but they all are used to stop nausea and vomiting, okay? A lot of them will cause dry mouth because it's drying up those secretions, okay? Remember I said Reglan, that's the medication. It's not necessarily for people who like have nausea and vomiting that's triggered by like medication or anything like that. It's nausea because they have delayed gastric emptying, which means food kind of sits on their stomach. You ever been like, ate a whole lot and the food is just there and you feel sick? Or that, okay? That can cause like a sick feeling, okay? So Reglan helps with that delayed gastric emptying, okay? So before we give antiemetics, of course, baseline vitals, because a lot of these are going to drop the blood pressure, a lot of these will drop that pulse rate. Level of consciousness. Why do we think about level of consciousness?
Because they.
It slows their heart rate down.
Drowsiness and drop their heart rate or blood pressure.
As if you have a patient who is kind of out of it, like their level of consciousness is low, we have medications that can be given under the tongue or sublingual. That way we don't have to worry about them swallowing it. You can kind of just slip it under their tongue and it'll dissolve, okay? Why would we need to assess for bowel sounds?
See if it's working.
Okay, what else?
Consultation.
Sometimes constipation can cause nausea, okay? Sometimes constipation can cause delayed gastric emptying because the food is just sitting there because it can't go anywhere because stool is there. Does that make sense? Kind of backed up like traffic, okay? Want to get a complete list of drugs the patient's currently taking. So if they're taking promethazine, which I know is going to cause drowsiness, dizziness, it's going to drop their blood pressure, it's going to drop their pulse. What other medications would I be concerned with them taking at the same time? Sometimes heart medicines. What else? Vasodilators. Yep. What else? What about digoxin? Would I be concerned with digoxin?
Yeah,
Why?
because it slows your heart rate down.
Because it slows. Look at y'all.
See, we told you we were paying attention.
Y'all do be paying attention. Okay. So after we give the medication, we're going to check for episodes of nausea and vomiting. So I want to make sure the medication is working. Okay. If I know that a medication is going to cause nausea and vomiting, I want to prophylactically give them an antiemetic. For example, if I have a patient, I know chemo is going to make them throw up. I'm going to give them ondansetron or Zofran about 30 minutes before it's time for their chemo. Now, will they still probably throw up? Maybe, maybe not. But it's easier to prophylactically give them medication as opposed to not giving it. Make sense? Of course, I want to do vital signs, daily weights, the status of their abdomen. Okay? Let's say that I have a patient who's complaining of nausea. I'll listen to bowel sounds and they're very, very slow. And I'll look at their abdomen and it's very distended and it's hard. What could probably be the cause of their nausea?
Constipation.
Constipation. Okay? So that means I need to try to relieve that constipation and that will help relieve that nausea. Make sense? All right. I will report any signs of respiratory depression. Which one of these medications would cause respiratory depression?
Promethazine?
Promethazine. Yes, because it's considered a CNS depressant as well. Okay. It's going to drop their blood pressure. It's going to drop their pulse. Okay. Everything's going to be slowed down. So I want to check those respirations. Okay. So of course I want to teach them about driving or operating heavy machinery, okay? They may want to use sunscreen, all right, especially if they're using medications that have that drying effect, like antihistamines, anticholinergics, all right? What's an example of an antihistamine?
Benadryl.
Benadryl, all right? Don't forget promethazine or Phenergan is also considered an antihistamine as well, okay? I want to teach them about foods that increase bulk and the importance of drinking enough fluids to prevent constipation. Because again, we know constipation can sometimes cause nausea and vomiting as well. Okay? When somebody does have a lot of nausea and vomiting, what kind of foods do I want them to eat?
Low acidic.
Maybe fiber. Okay, low acidic. What else? Come on, y'all nutrition people.
Salty. Oh, well, no. Well, because you said, wait, if they're, what was the word?
Nausea and vomiting. What kind of foods do I encourage them to eat?
Because we
Ginger.
always, because we give saltine crackers.
It's the cracker part. It's not the salt.
Oh, I didn't know. I was like, I never knew. Look, okay. I never knew. I just knew we gave saltine crackers for.
That's some old people teaching.
We used to tell them to have a brat diet. So that's bananas, rice.
Oh, yeah.
apples,
I forgot about
toast.
that.
Not salt.
Okay.
Something dry.
Something that's just bland. Okay,
I
something
always thought it was
bland.
the saltine.
The banana rice, apple.
And crackers kind of go in that toast.
That's what I said. I thought it was the saltine because baby, who keep a deck of them in the house?
So ginger is an herbal product that's really good for nausea and vomiting. That's why you ever had your mom tell you, go drink some ginger ale when your stomach don't feel good?
Yeah.
It's the ginger that's in the ginger ale. Y'all, it took me being in nursing school to realize that. I was like, oh, ginger ale.
But you know they under a lawsuit for the false advertisement of the ginger ale, right?
Which company? Because they got, all kinds of ginger ale.
Is it Canadian Dry? I think it is.
Oh,
Yeah, this has been going on for about 2 or 3 years. Somebody actually like did a whole little study or something, and they was like ginger is not actually in the soda or something. I don't know, but they under a whole lawsuit. And this been going on for a few years.
Canadian Dry.
It may be just Canadian Dry.
Trying to dilute their products to make it last.
Yeah, I remember I heard that. I was like, you know how many people been drinking ginger ale for years for that?
Yeah, I get the Walmart brand. Okay, but ginger's really good. But you know, pure ginger is really
It's strong.
yeah.
Boy.
It's bitter. You just need a little piece.
But guess what? When I had COVID, that little old lady told me I ain't see what to do. I should be.
Yep, for real.
All right. Questions about nausea and vomiting. So if we know that they're gonna have nausea and vomiting, I should pre-medicate them, right?
Yes.
What medication is really good for medication-related nausea and vomiting?
Zofran.
Zofran or ondansetron, okay? Which one is commonly given along with codeine, especially when you have like pneumonia? You're like really sick? Promethazine. What's the problem with promethazine?
Drowsy. Make it lean.
That. Okay? Questions. Let's say I have a patient and they just never have like a real good appetite. They don't go to the bathroom a whole lot and they're always complaining of nausea. Which medication would benefit them as an antiemetic?
They don't go to the restroom.
They don't go a lot. They don't really have an appetite.
The Reglan.
Reglan, yes, because they have delayed gastric emptying. Okay? Questions? All right, constipation. Y'all know constipation is not a diagnosis, right? It's not a disease, it's a symptom. So constipation is usually caused because of something. Either you don't have enough fiber, your peristalsis in your intestines are moving too slow, you're not getting enough fluids.
Your
Okay?
medicine.
Could be your medicine. So all these different reasons, okay, can cause constipation. Misuse of laxatives though. How in the world can that cause constipation? Because laxatives kind of make you go, right? So how can misuse of them cause constipation?
Overusing them, so his body gets used to.
All right, so she said dependency. So a lot of older adults, they kind of teeter-totter between being constipated or having diarrhea.
And they be obsessed with them.
But the thing with laxatives though, if you use them for longer than you should, then your intestines stop working. They no longer have that peristalsis, the stool just sits there, okay, until you take the laxative, okay? So if you misuse laxatives or you overuse them, then your intestines stop working, okay? And let's say all of a sudden you're like, I don't wanna take it anymore. You kind of train your intestines to be dependent on that laxative, and it can't have a bowel movement without them.
You must not have no life to be taking laxatives like that.
The same like tea?
Yes, some of those teas as well.
That you drinking now?
No, but I'm always drink tea sometimes to help me because it's not good, but.
It depends on what's in the tea. So some of those detox teas have like one of the hidden ingredients is a laxative, so just be careful with that. Cause you know, everybody wants to detox and all that kind of stuff, but you've really gotta read the ingredients on there.
They say like a smooth something, the tea.
The ingredients. And a lot of
Yeah.
people misuse laxatives because they think it helps them lose weight. But you're not really losing weight, you're losing
No,
water.
just because it's hard for me.
So that's what I was gonna. So what is the difference like when people use the detoxes?
It just depends on what's in it. So some detox teas have just a whole lot of caffeine.
Well, I didn't mean the teas. I just meant like they have the different type of detoxes, capsules and stuff like that.
It's got a laxative in there. That's what Senna is.
Mm-hmm. Y'all be drinking all that crap, following the trend and all that.
Yeah, so some detox teas don't have a laxative in it. It's like caffeine or it has like other herbal products that are in there. But those teas that have a laxative in there, that's what's making you go. So just be careful about the ingredients in there
And how often?
and how.
So there's like the same, like at the school, something like beer? Is that the powder?
For Miralax?
So that's a little better, and we're gonna talk about those different, types, but that's a little better. Alright? So how constipation works? What happens is your stool is moving slowly in your intestines. The longer it sits there, the more your body absorbs the water. So if you're absorbing water, guess what happens to your stool? It gets hard, right? And it makes it hard to come out.
All right, say that magnesium citrate, it's bright, that bottle. What? I can get it out there one time.
So these are the different types of laxatives, okay? We have bulk forming laxatives, like psyllium, okay? We have stool softeners, like Dr. said, we have lubricants, like mineral oil, saline laxatives, and stimulant laxatives, okay? Bulk forming laxatives, like psyllium. I'm gonna go back to your book as well, because I think your book has a nice little chart of this as well.
One on 364 and 365.
Yes, all right. So this little chart is really helpful. So this is things like psyllium, like Metamucil. Have y'all heard of the Metamucil challenge? So they have like, it's like a 2-week challenge, keyword 2 weeks. 2-week challenge. So what, and Metamucil is considered, our citrusel, is considered a bulk forming laxative. So what it does to make your stool easier to come out, it makes it fluffy. So it makes like your stool like a little jelly, and it adds water to it, so that means you gotta increase your fluids, okay? And you know how like a cloud, so think about a cloud. The more water a cloud has, the fluffier it is, right? Same thing with your stool, all right? So bulk forming laxatives add bulk by making the stool fluffy.
That's why I'm gonna tell you, after you mix it, drink it fast.
You gotta drink it fast because it becomes a jelly. And if you don't drink enough water with it, instead of it being fluffy, it's gonna turn hard like concrete. And it can cause an obstruction, it can cause an esophageal obstruction.
So after those 2 weeks, your bowels are perfectly fine now?
It's not that it's perfectly fine, but sometimes people, they have like a sluggish bowel and they kind of have a lot of stuff backed up. And it could be because they're not getting enough water, all this kind of stuff. But by adding Metamucil or citrusel, which has psyllium in it, it's gonna make that stool a jelly. And as long as we add that water, think about what a jelly does, it kind of sticks to stuff, right? It'll pull all that old stool and stuff out and get it out as well. But the key thing is they have to increase their water intake. If they don't increase their water, it can cause an obstruction. Make sense?
So what ingredient does, stuff when you get, have aches and pains, it's called, salt, Epsom salt, what ingredient does it have in it that you be used for laxative?
Cause my old man used to drink it.
It's the salt, we don't talk about it, that's a saline laxative.
Okay.
Alright, questions about bulk forming laxatives. So a lot of times, this is in powder form. So we gotta add, and they tell you to add cold water to it. Cold water, and hurry up and drink it, and then drink a lot of water, okay? The key thing is increasing your fluids. If you don't increase your fluids, then you can possibly cause an obstruction. Make sense? Have you ever tried Metamucil? It's really, I guess, cool looking because once you mix it, you can see it starting to turn into jelly. It's like, you don't have to drink that. That's why they tell you add cold water and drink it fast. Okay? All right, questions about bulk forming laxatives. So it makes your stool fluffy so it can pass through easier, it's nice and fluffy. And you gotta have water with it. Then we have emollients. Emollients are also called stool softeners, all right? A lot of times, how these medication works, this is like Colate, Surfat, Dopacet, all right? And a lot of these are over the counter. As a matter of fact, citrusel and Metamucil are over the counter, all right? But with stool softeners, it doesn't necessarily soften your stool, it makes it greasy. So it can slide out easier. That's why they call it emollients, okay? That's why a lot of times when people are taking stool softener, they can't hold it.
Them Docalex, them things ain't no joke. For them to be so little, I had never heard of them. And after I had my third son, they were giving me Percocets for pain, and I was taking them. And man, my husband went and got me some. I didn't read the package. I just said they little. Took me about 4 of them.
4 of them, girl.
Oh my God.
Loosen that booty up, huh?
Girl, I cannot with you.
Oh, greasy booty.
So that's what happens, it lubricates it, it makes it easy, so it can easily slide out. So it doesn't soften your
What no
stool.
joke.
Don't soften it, it lubricates.
Oh, okay.
You win.
Was
Did you
crying
stand there
for
like, "Ooh"?
no, was on the like facing backwards on the toilet like this crying because it wouldn't stop. My husband was like, "What you want me to do?" I'm like, "Close the door."
Just think about when you grease something up, it's slippery, right?
Yeah, it was. I ain't took them things since, I swear.
Now, so that's basically understandable, right? Emollients, they consider them stool softeners, but it's not softening the stool. It's just making it slippery so it can easily come out of the intestines and stuff, okay? Sometimes we have emollients combined with stimulants. I'm gonna skip over that for right now so I can talk about a stimulant laxative. Then you understand it combined. So a stimulant laxative is the ones that hurt, okay? Because remember, sometimes we have constipation because our intestines won't contract and kind of move it along, right? So stimulant laxatives force your intestines to contract, all right? So their main side effect is cramping, okay? That's medications like Biscolax and Docalax. Don't get them confused with Docacet, okay? Docacet is actually the emollient. Docalax is the stimulant, okay? And a lot of times, that little pill is so tiny. However, it packs a big punch because it's gonna force your intestines to contract. So it's a lot of cramping that they have, okay? Questions about stimulant laxatives?
Why it gotta hurt?
Because it's forcing a contraction. It's forcing your intestines to contract.
So would that be better then?
No.
And it works.
It's
It
a
works.
it would be like an involuntary muscle movement.
Yes.
So I don't think it would be good.
No, it just.
It works though, because it's
Yeah.
forcing the stool out, but it's forcing a contraction. Kind of like uterine contractions as well, kind of similar. Okay? Questions about stimulants. So, the main thing that I want to educate my patient about with stimulant laxatives is you're going to have a lot of abdominal cramping. Okay? But with all these, we want to increase their fluids because they're constipated. But the main one we want to increase the fluids for are those, what?
Ceiling.
Bulk forming laxatives. Because I need that water to make that stool fluffy. Okay? So let's jump back over here to emollients combined with stimulants. Okay? This is pretty powerful, yes? Because not only is it forcing contractions of your intestines, but it's also lubricating the stool as well. So, we gotta educate that patient. You may have relief from constipation, but it may be hard to hold it. Does that make sense?
Mm-hmm.
Because it's slippery and we're forcing contractions to force it out. Okay? I don't know who would want that, but.
Right.
All right, then we have osmotic laxatives. Who was talking about? You were talking about saline, Epsom salt. Okay, so saline. All right, with these osmotic laxatives, they got a lot of salt in it. Because what happens with salt? Water follows it. So whenever we're taking these osmotic laxatives, it's bringing a whole lot of water to that intestinal area to help flush out the lower GI tract. All right. So this medications like lactulose. Okay. Now lactulose can be used for 2 reasons. Remember way at the beginning I kind of talked about lactulose, how it's used for liver issues, end-stage liver disease, as well as for constipation, because it's gonna cause explosive bowel movements.
Mm-hmm.
Look, Dr. Thyssen, what is in orange? Does that make the bowels orange, or does the jaundice from the liver from?
It's the jaundice from the liver.
Okay, makes the bowels orange, okay. That little cup ball,
Oh, it packs a punch.
they amount.
So a lot of times we don't give lactulose for constipation.
Yeah.
The majority of the time we give it for somebody with end-stage liver disease, okay? And the reason for that is because it's gonna get rid of ammonia, all right? So we teach them, yes, you're gonna have some diarrhea, but that's how it works, and you have to take it. Remember I told y'all, like in Katrina, where I had that volunteer nurse that came and she
Didn't get a person.
did not give that patient the lactulose, she's gonna take it 3 times a day, and within a few days, he was in a coma. It's because those ammonia levels got so high, all right? So we gotta know all the indications for these medications. So can lactulose be used as a laxative? Yes, but majority of the time, it's used for end-stage liver disease, okay? Another one I want you to know is magnesium hydroxide, okay? Magnesium hydroxide, or milk of magnesia. So y'all should have learned in,
Wait on,
nutrition
just teach us again.
that magnesium causes what?
Constipation, not constipation.
Magnesium. What does magnesium cause? Is it constipation or diarrhea?
Diarrhea.
It causes diarrhea. So milk of magnesia is an osmotic laxative, all right? You ever heard somebody they're just throwing back milk of magnesia all the time?
Mm-hmm. But old people used to do it. You will see that a lot in their houses.
Right, because they go from being constipated to having diarrhea, so they go back and forth, all right? Some people use this to induce pregnancy. I do not recommend.
What? Really?
I do not recommend it.
Look, really?
It's because
I'm
the
just
same
playing.
muscles that you have to use to expel stool is the same muscles to start those
Contractions.
uterine contractions. However, the problem is you can dehydrate yourself. You can drop your blood pressure, okay?
The doctor, they use this for,
All is well. Huh?
You pooping while you giving birth?
I mean, yeah.
If you got to, yeah.
Yeah.
I drank caffeine.
Look, bitch, we talking about shit right now. You unused to this.
It was time.
We talking
So
about.
you're gonna be pooping while pregnant.
Have y'all ever heard of, Go Lightly?
yes.
So that's polyethylene glycol. So usually we give that to people who have to have like a total bowel cleanse for like
They use
either
a
a
bowel
procedure.
prep now thing.
Yeah, so that's considered like an osmotic, laxative as well.
They don't go lightly though.
A lot of people are kind of straying away from Go Lightly because patients are kind of non-compliant, especially if they gotta go home with it, cause it's like this big gallon.
They do the smaller ones or the bigger ones, and the men be the worst, I swear. I'm like, they don't want to take it, and they like, how much of this stuff I gotta drink? And then once it start working, they crying about it.
Yeah.
They can't stop pooping, and I'm like.
So the thing with these bowel preps, especially Go Lightly, the best way to give it is to keep the jug at the nursing station and just keep bringing them cups. Because if you bring them that whole gallon, it's pretty overwhelming.
Discouraging.
It's overwhelming. You gotta look at it like, oh, I ain't getting nowhere. But if we keep bringing in like them cups and put it on ice,
Mhm.
it's nasty. I mean, it's not nasty, but it tastes like salt water.
Yeah.
All right, so the more ice you put with it, the better it is for them to take it. And it's just always better just to keep bringing them cups. When you see, oh, your cup's getting low, just bring them another one. And you'll see they'll drink it faster as opposed to the whole gallon sitting there like, oh, make sense? There's also sodium phosphate or fleet enema, all right? So instead of taking it orally, they're going the back way. Okay, but it works the same way. It's using all that salt to pull that fluid into the intestines to flush out that stool, okay? Usually as soon as we give that enema, a few minutes later, that stool is coming out, okay? Questions? Questions?
So the Epsom salt is they just add their water?
Yeah, so it's the exact same thing, it's just you just making it yourself. Now, these things are kind of put together by like the pharmacist and all that kind of stuff, but the main ingredients is water and salt, all right? Okay. are very similar to emollients, but they lubricate even more, okay? So she was over here talking about castor oil, okay? Glycerin suppositories. So again, it works very similarly to emollients, but it lubricates it even more, okay?
That's
Questions?
about the best one, huh? The glycerin, suppository. That's about the safest one.
So I would rather a suppository for, constipation as opposed to drinking something. Now, of course, drinking something will work better. However,
I don't want the cramps.
correct. And with suppositories though, although the side effects may not be as severe as drinking something orally, eventually you may have some swelling in that area. Especially if you're having to use the suppositories a lot, okay? You may have some irritation and some, swelling in that rectal area, which now you got a whole nother problem, okay? Questions? Questions?
No.
So it's pretty easy to understand the difference, right? It's a lot. But bulk farming, what's the main thing with bulk farming laxatives? Increase your water, all right? Stimulant laxatives, what you gonna tell that patient?
Watch out.
You're gonna have some cramping, all right? What about osmotic laxatives?
It's given for, lower GI, but you can say, just little bit.
You can, that's specifically lactulose, which is for end-stage liver disease. But with those, osmotic, laxatives, a lot of times it's for bowel prep, all right? Well, somebody needs a colonoscopy, or they have to have surgery, and we need all that clear, okay? And the instructions for that, if they're having a procedure like a colonoscopy or a sigmoidostomy, all right? We tell them to keep drinking it until their stool is clear like water, okay? What if it's a little hint of brown? It has to be clear like water. I got yelled at one time by a, gastro doctor because, yeah, it was water, but it was still brown, which means they couldn't see anything on the scope. Okay, and it was like, why do you keep, I was like, couldn't say nothing. I was like, okay, first year being a nurse. The patient, listen to the patient. I had this before the doctor, as long as it's liquid, it's fine. Now I'm a whole nurse, and I'm like, you know what?
All right, you right.
Right, as long as it's, but no, that was not right, okay? Questions? Questions?
So for the exam though, we need to know each and every one, well, for the comprehensive exam, we need to know each and every one that you went over.
Yes, so for bulk farming, you need to know that the main ingredient is psyllium and that's citrusel and metamucil, okay? For the emollient or the stool softener, that's docosate, trade name, collates, all that, but it's docosate, all right? I'm not gonna go into emollients combined with stimulants, because we don't give that a whole lot, because that's a lot, all right? Stimulants, that's Biscolax or Docalax. Don't confuse that with docosate, okay? Osmotic laxatives, that's medications like lactulose, but you also should know lactulose is mainly given for what though?
Bowel prep.
Liver,
End-stage.
end-stage liver disease, okay? So that's magnesium hydroxide, polyethylene glycol, and sodium phosphate. Those are the three main ones that are osmotic laxatives, okay? Lubricants, castor oil, and glycerin suppositories.
Okay, backing up a little bit. I thought just 2 minutes ago you said the osmotic laxative was bowel prep. Yeah, but just 20 seconds ago you said end-stage liver disease.
That's lactulose.
So lactulose.
Out of the group of lactulose issues for the end-stage liver, these are more bowel prep.
Oh, God, okay.
Oh, she was about to go hard.
She
Watch
was.
out.
I'm just making sure.
20 seconds ago, I'm like,
I'm too. Watch out.
I'm a little drought, but I had some lean, so I'm a little.
Yes, well, you give it
I'm a
to
little.
You should want us some.
y'all know that kind of making a surprise, visit today.
I'm just joking.
You need some water? No, I'm tired. I'm over here fighting to stay up though.
You counting?
No, y'all take out 2 minutes.
You counting good.
Get up and walk around.
No, I wonder why she was on our, survey thing. I should have put on that board out.
Oh, yeah, that's a Y'all got your books up?
Oh, yeah.
Yeah, go get them for, Miss Darcy.
You still doing that?
Yeah, you gonna do it for extra credit.
I can't even register for my phone.
Why not? You still can't. Well, it should be fixed, but she said don't worry about it, cause you still gonna be in the class. I ain't buying nothing till she gets finished. She here. Next time, I'm picking up everything.
Where y'all at?
Yeah.
And they're a little bit more, they were a little bit more expensive too, you know, cause everywhere I looked, it was like almost 7, if not 7. And I was like, let me put it. He kind of backed off a little bit.
She said she was giving us the guy for Tuesday. And my sister, she said she don't know. I just want to, yeah.
I need to be in the day.
Yes.
I'm staying with you. Believe me, I tried to save it, but I couldn't. Other stuff kept happening. I say, man, people shopping, like, I don't know.
Is it the same hair y'all always use?
It is, but when I Googled it and did research, well, not all the braid hair, cause I found some like, when I say, it's supposed to be, yeah. All braid hair, they spread with the type
But see, that wasn't like that
and,
when I was
they spread with alkaline. And, yeah, the girl said, no, but not necessarily, I just said, yeah, so in, apple vinegar for like 45 minutes before she could come in. And then after they put it in, see, I was already in,
What is it?
I had to go get an oral, medication to help that. So, yeah, I took it out. My husband said, "These is the days." I'm like, yeah, I'm like, it's thinking it's like, I'm like, I know her. So I took it out, and I'm probably just do like twist my own hair and do something else, but, I found the company, I think it's called, I forgot, it's called with a N, but Asian hair name brand is called Easy Braid, and then it's chemical free. They have like, natural products, and then like, So, I said that, not right now, but maybe later, try, if somebody could maybe like cover it, and just see what it do. And then if it works, they will. I was mad, though, I don't know if it's a waste of money. I didn't know I was gonna break down like the lady used the same thing. That money was, there was regular box price, it was like 100.
You bought that?
She had to have two?
Oh, girl, that's good.
So I would have been in here, I've been outside since then, so I had to just let her talk because I'm like, and you said that that's on.
I would have rather been off. Well, he got no experience, that's the big issue. That's got that bit. Oh, I love it. If Vivian
That's not like,
Oh, yeah, no.
they're not as.
For girl, no, I booked 4 appointments today and didn't even know I did it until yesterday. So I had my daughter's appointment this morning at 9. We left the house at about 8:30. Left her appointment, went straight to my appointment for the baby, and then my other appointment for the baby was booked today. And then my daughter's hair appointment. So I had to leave my daughter at the beautician. She was almost done, just so I could run to get her on time. And I'm like, I have not been at home since.
Like a wow.
No, it would have. If she would have started on time, it would have been finished. I would have been done. But she started like probably like 20-30 minutes late because one of her other clients was still in the chair.
So now you have to pick her or someone?
I already paid her.
Oh, okay.
Yeah, I already paid her. And then tomorrow I got a hair appointment, and then the funeral is this weekend. And I'm like, I'm over. I'll be glad when all this shit over. This has been a busy month. I'm just making it. Yeah, I'm wore out. I fell asleep at the girl house while she was doing my baby hair, and then when I woke up it was 3:20. I was like,
Well, I'm not pregnant. I was in my son's dentist appointment and I went.
the sun. It's just the heat though. Like it's just draining.
Alright, so diarrhea is not a diagnosis either, right? Just like constipation, it's a symptom. Okay? What's the biggest problem with diarrhea?
Dehydration.
Dehydration and electrolyte imbalance.
And your booty be wrong.
Wrong. That's it. So we know that diarrhea can be caused from bacteria. If you have a bacterial infection or something like that, it can cause you to have diarrhea. It can be contaminated food. It can be some medications you take. So it's all different reasons why somebody may have diarrhea, right? It can be because they have a lot of anxiety. All right, so a lot of people, you ever been like in a class or something like that, you get real nervous and you gotta go to the bathroom?
Bubble guts.
All right, so there are several different types of medications used for diarrhea. We have anti-motility, adsorbent or absorbent, and also anti-secretory. Okay? So anti-motility, these are medications that's basically gonna do what?
Stop you from having diarrhea.
Right, so slow down our intestines, okay? Because our intestines are cramping too much, which is causing us to move stool too fast. All right, if we move stool too fast, then our body does not have time to absorb the water in our stool, okay? We have adsorbents or absorbents. What these medications do is it's kind of sticky. And let's say that it's you ate something and it's contaminated or some type of poison or something like that, or some bad food, it'll stick to the toxins and bring the toxins out of the stool with you. So as long as you remove the toxins, then you're removing what's causing the diarrhea. Make sense? Then we also have anti-secretory, okay? Anti-secretory means anti-secretions. What's another name for anti-secretions? What's the medication class that stops secretions?
Scalalopin.
All right, so that's the medication, but what's the class called?
Oh. It ain't coagulants, it's
We talked about it earlier. You just said
coagulants? No, cause it's not coagulant, it's
anticholinergic.
Oh, okay.
Y'all had it.
Look at every time word.
Anticholinergics, yes. All right, so we're not going to megacolon, y'all don't get that in your med surg class. But I'm gonna go to the little thing in your book, because again, it has like a nice little chart. So anti-motility drugs. These are medications that will stop how frequently your intestines contract, okay? The two medications are Imodium, loperamide, and atropine or Lamodal. Atropine is also an anticholinergic, right? But it's gonna slow down those intestines. Okay? The main anti-motility medication is loperamide, which is Imodium. And my mama seems to have that in her purse. Yes. And she just drinks it out the bottle. She don't measure it, she just. Yes, people do that with Pepto-Bismol too. They'll just keep it and they just kind of, y'all get on my nerves. Y'all do that, right? Okay? So it's an anti-motility drug. It's going to slow down the intestines. Because I know it's gonna slow it down, what's a possible side effect? Constipation. Okay? That's especially in older adults. In older adults, when I say they go back and forth from being constipated to having diarrhea, it's because they're on all these medications. So you may see they're on a medication for constipation. They're also on a medication for diarrhea, because they take one and it instantly puts them in the other. So they gotta take that medication instantly. So it's kind of like a teeter-totter effect, especially with older adults. Okay? Questions about anti-motility. What's the main medication? Lamodal or loperamide, which is Imodium. Okay? Adsorbents. Okay, again, these medications stick to the toxins that are causing the diarrhea. All right? So if you got like food poisoning, okay, from some bad food, you take an adsorbent, it's going to stick to the toxin and help get rid of the toxin out your stool. So as long as you get rid of the toxin, you get rid of what's causing the diarrhea, okay? What's important to know is these different categories of antidiarrheals, we give them based on what causes diarrhea, okay? So if their intestines are moving too much, we need to give them what? Imodium, because we need something that's gonna be more like an anti-motility. If they had food poisoning or something like that, then we're gonna give them an adsorbent or absorbent, because it's gonna stick to the toxin and get rid of it through the stool, okay? Then we have, and that's medication like bismuth subsalicylate. Now the key thing with bismuth subsalicylate, okay, or kaopectate, okay? Guess who can't have this? Children. Why? That subsalicylate, that's aspirin. Okay? Aspirin are salicylates. So kids shouldn't get it. Okay? Right? Kids really shouldn't get it. Alright? Usually if it is a child that has to have it, they use it like an older child. Okay, they use it like an older child. But really kids shouldn't have it. Okay? And then there's Fibricon. Okay? But the main thing to know is that adsorbents or absorbents are used for people who have like some toxin is what's causing the diarrhea. And we need to get rid of the toxin.
What is
Make sense?
Fibricon?
Then we have anti-secretory drugs. Okay? And you also notice that bismuth subsalicylate is in this category as well. Alright?
So why does one say Pepto-Bismol and then one say Keopectate?
It's just the manufacturer.
My
That's
insurance
all.
saying
It's the trade
Pepto
name.
Bismol, all they like.
I'm about to say, yeah,
So-
it's no for kids, so don't have that in it.
It does.
They gonna try to kill their children.
It does. It doesn't have as much aspirin, that's why it says subsalicylate.
Okay.
But if we don't have to give it to them, we don't want them to have it. So if you notice, it says not recommended for children.
You know what I'm saying?
That's why I was like, wait, so the other one,
It's the same medicine.
so both of them, no for the kids.
It's not recommended because of the salicylate, which is aspirin. Basically
Okay,
aspirin.
cause I'm looking at the
It's
dosage.
not 100% aspirin, but
It still has
it's
it in it.
enough of it. It's enough of it.
And according to a child's weight or something, it could probably
Right.
affect them.
So we just stick to them over
You know how
here.
many times I gave my kids
For
Pepto-Bismol?
real?
Did you notice anything different when you gave it to them? How old were they?
Young, nothing surprising. I mean, my son is only about to be 16 now, so I'm
Just
sure
going to
when
like
he
a little
was
better
complain
Gabby.
the stomach issue, I didn't give it to him. I mean, who don't? How old is it? The son's about to be 16.
Or 16.
Yeah. Definitely not recommended to children though.
I mean, he good now.
So we just gonna pick them over here.
Yeah, I remember getting Pepto-Bismol.
Questions?
That's nice, and when we finish this class, we gonna have no medicine.
There's another thing that's not on here though, that can be used for diarrhea, okay? Let's say that we have diarrhea that's caused from like, antibiotics. So when you're on antibiotics for a long time, sometimes the good, the antibiotic kills like the good, bacteria as well. So what do you think we can do to stop that diarrhea that's caused from getting rid of the good bacteria? Probiotics, yes. So probiotics are used when we have diarrhea that's caused from antibiotic use. Cause we wanna put that bacteria back into their gut.
They said we're supposed to take it anyway, though.
No.
It just depends. I don't want anything extra that I don't necessarily have
Right.
to have, but if I know that I'm losing it, then yes, I'll add a probiotic.
So they said it's sort of like, one who have reoccurring BV.
Yes.
I guess, in that case, they should use it often.
Questions. So it's not on here, but probiotics are also used for diarrhea that's caused from prolonged antibiotic use. Okay?
And it's under the
It's not on here at all.
No, I'm
What
saying,
class would it
be-
fall under?
What class would it fall?
It would be just a probiotic. Cause it's not stopping the motility. It's not, doing anything with like the secretions or anything. All it's doing is putting that bacteria back into the gut.
Which one would you use? They have like, like the different types of probiotics. They have the digestive health, they have the colon.
They all do the same thing. It's all just, so the way they make money is by changing the name. But it's like Tylenol PM, that PM is just Benadryl. So if you really just, like if your whole problem is you just need to sleep, you can go get the 50-cent Benadryl which is the same ingredient as the $8 Tylenol PM.
That's fine. I look at the ingredients when I go to the store. I like that my hand in the bag. I'm like, let me look, that's the same thing. I'm like,
Same
let me look
thing.
at this.
You paying for the name.
What it is.
Yeah, just like, the Walmart shoes and Nikes, they're both shoes, but you're gonna pay a little more because one says Nike. However, my son, he don't care, he will go to Walmart and buy some shoes. I'm like, no, alright.
And them was some of my best work shoes I had purchased. I swear I kept them shoes about 3 years.
Alright, so questions about those anti-diarrheal medications? Alright, so the main thing is, beforehand, we need to check the medications, see what's causing the diarrhea. That's the major thing. We need to see what's causing their diarrhea. Alright, if it's because they're super nervous or they have like, sometimes IBS, like whenever they get nervous, their colon starts to contract, then what type of, anti-diarrhea am I gonna give them? Anti-motility, alright? If they've been on antibiotics for like 5 weeks and they have diarrhea, what type of anti-diarrheal am I gonna put them on? Probiotic, okay?
Is that why like some patients, if they're on a harsh antibiotic, they develop like C. diff?
Yes. Yep, it's because the antibiotics are eating all the good bacteria that usually keep C. diff in line.
Right.
That's the thing too.
Yes, it does. Okay. Of course, we want them to take the medication as prescribed. Do not double doses, because that definitely can cause constipation. Okay? So sometimes patients feel like, oh, I missed a dose, let me go ahead and double it. They will definitely cause constipation. Okay? Sometimes these medications can kind of make you dizzy, have like that little effect on you. You change in like your fluid status and all that kind of stuff. Okay? And if they have no relief in about 2 days, that means something else is going on. They need to contact their physician. Okay? Y'all, we never, and I don't wanna say never, but it's not recommended for us to treat diarrhea if we don't know the cause.
Right.
Okay? I don't want to say never because sometimes they do, but it's not recommended. Why do you think it's not recommended to treat diarrhea and we don't know the cause?
Because sometimes it's your body's natural way of getting rid of the bacteria and stuff.
I just let it take its course.
That's because most doctors say even with kids to let it just run its course first before you start trying to.
And a big thing with kids is because a lot of these anti-diarrheals have aspirin in it, and we don't want them to take. Okay? All right, we want to avoid alcohol and other CNS depressants, okay? Because some of these can kind of make them drowsy, okay? Want them to take the medication as prescribed. You need them?
Hey, Lynn, how are you doing? Hello. Good, Dr. Thyssen. How long are you gonna be here tonight?
From 6.
That's a good.
As long as you need me?
Oh, no. Mr. Weir is here, one of the instructors, and she just kinda wanna know if she's here by herself. Cause I'll be leaving in about 20 minutes.
Oh, gotcha. Probably till like around 8.
Around 8? Okay. I know you guys can't register, I know, so. All right, by 8 o'clock, thank you.
His doors with the little tight clothes on.
Hey.
It's the weekend, baby. Don't play with it. None.
She got a pistol too. She don't really need you. She already let it know. You remember she told us? No, but you remember what she told us? She said, "Don't try to run up on me."
We'll be way back here. You can't hear too good. I was listening for my voice too.
Okay.
Flashbacks.
No, Nick, you remember when she told us, "Don't try it." So I'm like, don't run up on me, cause I'm packing now.
Pull that mask down.
Don't do that.
Don't do that, you don't know.
No, we know.
We know.
All right, so medications for gastric ulcers and reflux, alright? Everybody knows what GERD is, right? GERD, gastroesophageal reflux disease, or increased acid. Everybody knows what ulcers are, right? They either can be in your esophagus, they can be in your stomach, sometimes they're in your intestines, but most of the time, it's in your stomach, okay? All right. Not gonna go into detail about digestion, all right? But I am gonna tell you some key things so you can understand why some patients get ulcers, okay? We already know that, the stomach produces hydrochloric acid, right? What's the key word?
Acid.
Acid, okay? What is the acid used for?
Eating
Break
up
it
stuff.
Break down food, helps to break down the medication so we can absorb it. So we need it, right? The problem is when we have too much of it, it can cause ulcers. Or if we have a whole lot of it and there's nothing in there for it to break down, all right? So y'all heard of the phases of digestion, right? In anatomy, the phases, what's the phases?
She got jokes.
Dr. Thyssen, we learn into something new every week.
Look, every day.
It starts in your
Our
mouth.
mind is on this.
Okay, so I'm gonna take that, it starts in your mind. So a lot of people think that digestion starts in your mouth, it starts in your mind. So there's a cephalic phase, there's an oral phase, and there's the gastric phase. Y'all remember that?
Can you spell it?
All right, cephalic phase means anytime we think about food, we see food, we smell food, hydrochloric acid is going to start being secreted. Okay? What did I say? When we think about food, when we see food, when we smell food, our body automatically starts getting ready for food because it's like, oh, okay.
That's why you get the hunger pains.
Pretty much, yeah.
Like,
Right.
my mouth is no
So,
water.
what's the problem with that? If we have somebody who doesn't eat, what happens with that acid?
The building up.
It's gonna be there. You ever waited too long to eat, and by the time you start to eat, like, I'm not even hungry.
Yes.
Because that acid has built up,
Oh, wow.
and acid does what? It makes a gas. So sometimes you're like real
You can
gassy as
pull off
well.
the gas then.
Is that
So,
what gives you that constant full feeling even when you're not full? Because I
Yes.
suffer with that daily.
yes. So that's why we have to make sure that we eat regularly. And when we don't, we have issues with that increased gas buildup. And then when we finally do wanna eat, it's like we can't. It's a whole vicious cycle.
So that's what they said, when you put all the food on, you want to know.
Yep. Your body's busy
So we
ready.
should still try to eat at least something.
Yes.
Not a whole meal, but at least
At least
dibble on
something.
something.
Something, because what's gonna happen is that acid is there and it's waiting to break down something. If there's no food to break down, guess what's gonna start breaking down?
Your stomach.
Your stomach, and that's how people get ulcers. So think about people who,
I ain't gonna never lose no weight.
people who have anorexia nervosa. I'm not talking about just anorexia, the symptom, I'm talking about the eating disorder, all right? Although they're not eating, what's their body still doing?
Producing.
Producing that acid, because when they see food, their body is already doing what? Getting ready for food, right? It's gonna release that hydrochloric acid. But if they don't eat, and they constantly not eat, what is that acid gonna start doing?
Building up.
It's gonna start eating away at that lining of the stomach. So a lot of times when people have anorexia nervosa, and when they're finally ready to start eating again, it's hard for them, because their stomach is full of ulcers.
But you said, digestion starts in the mind, so your mind isn't telling them to eat, right?
No, it's a little different. Their emotions are telling them not to eat. Their mind is saying, hey,
want to
I
eat.
see food, let me go ahead and tell my stomach to get ready. See the difference? When you smell food, your body's like, okay,
It's
something's
coming,
happening. When you think about food, okay, it's about to happen, okay? So that's why a lot of people who have anorexia nervosa are on medications for stomach ulcers. Make sense? All right, so that's just my little introduction of the digestive system, you know, although y'all knew that already.
Dr. Thyssen, can you repeat the other two phases? I'm sorry, you
So
said
it's the
cephalic
cephalic
phase?
phase, oral, and gastric.
Okay.
So on here, it says digestion begins in the mouth. It doesn't. It begins in the brain. It's the cephalic phase. Because when you think about it, like you say, your mouth starts watering. It's like your body's preparing you for food. Okay? Questions? So there's different ulcers. They're named different depending on where it is. If it's in the stomach, it's a peptic ulcer. If it's in a certain part of the intestine, it's a duodenal ulcer. If it's in the esophagus, it's an esophageal ulcer. So it's an ulcer, we just name it based on where it is, okay? So, causes of ulcers can be a bacteria, like H. pylori, or it could be a lifestyle, like stress, diet, or lack of. It could be excessive acids, okay? So, and it's just talking about the ulcers.
Is why they be eating them tons like these Skittles?
Yes. All right? So anytime somebody has an ulcer, I want them to avoid anything that's gonna cause bleeding, right? Because what do ulcers do? Bleed. They bleed. Remember Lewis? He ended up with ulcers because of NSAIDs, and then they started to bleed. Okay? So GERD. GERD is gastroesophageal reflux disease. So usually that happens because they got a whole lot of hydrochloric acid. And it's so much that now it's starting to raise up into their esophagus and causing heartburn and stuff like that. Sometimes it hurts so bad that it feels like you're having a heart attack. Okay? So treatment for that is drug therapy and lifestyle changes. So we tell them to stop smoking. We tell them to decrease their fat, decrease like red sauce, because that produces a lot of acid.
Alcohol, like we get it.
Alcohol. We also tell them not to eat so late at nighttime when they're gonna just lay down and go to sleep, okay? Avoid those large meals. All right, so this is basically what acid reflux is like. So this is the stomach here, all right, and see all that? That's the hydrochloric acid, okay? And it goes up into the esophagus, and that's what causes like that heartburn type of feeling. Okay, sometimes it can cause like belching and stuff, okay? Sometimes it's caused from too much acid in our stomach. Sometimes it's caused because our muscle right here is weak and it doesn't close all the way, okay? So see how it's supposed to close? Sometimes the problem is it's weak and it doesn't close all the way. Unless we're gonna surgically fix that, the only way that we can really treat it is to give them things that either neutralize the acid or reduce the acid. Make sense? All right, so I'm gonna skip this because I wanna get into the different types of medications for GERD, okay? So we have histamine 2 blockers, proton pump inhibitors, cytoprotective drugs, antacid, antibiotics, and pro-motility drugs, okay? So I'm going to go to your book, your handy dandy book, and it should have a nice little chart in here as well.
Same way we knew 15 through 20.
What page?
379 is where the histamine H2 blockers start. Right.
All right, so histamine 2 blockers is very similar to histamine 1 blockers. Histamine 1 blockers are antihistamines like Benadryl. Histamine 2 blockers are for the stomach. So these are your Thyssen drugs. So if you see Thyssen on the exam,
Loratadine.
you know that is a histamine 2 blocker for GERD or for increased stomach acid. All right, like famotidine, ranitidine, cimetidine. These are all for increased acids. Okay? Anytime we hear the word block or inhibit, what are we doing?
Stopping
We're
something.
stopping something, all right? So histamine blockers are going to stop the excessive production of hydrochloric acid, okay?
These are for built up acid in the stomach?
Yeah.
Okay.
or it can even be for somebody who has like that weak muscle. And because I know that muscle is weak, even if it's not a whole lot of acid, because the muscle is weak, it's still gonna escape. So I still wanna decrease that acid as much as possible, okay? So FYI, histamine 2 blockers, our Thyssen drugs, are going to decrease the amount of acid. What are they gonna do?
Decrease the amount of acid.
Oh, look at y'all. Is that gonna happen fast?
No.
No, okay? I'm gonna move on to proton pump inhibitors. Anytime I hear the word inhibit, what does that mean? What is it gonna do?
Help.
Inhibit. It's gonna stop something as well. So when something inhibits it, it blocks, it's still the same thing, it's going to stop. So proton pump inhibitors also stop the production of hydrochloric acid. So it's gonna reduce the amount, okay? And these are our prazole drugs, like omeprazole, esomeprazole, pantoprazole, okay? These medications also decrease the amount of acid. All right, so they're both used to treat the same thing, increase amounts of acid, right? But proton pump inhibitors do something a little better, okay? So proton pump inhibitors are really good for ulcers caused by stress, okay? They're really good for just increased acid and also stress ulcers.
How come you tell a difference?
Okay, for example, I have somebody that's in ICU. They are stressed. Although they may just be laying there, they're not responsive, they have all these, their body is stressed because they're sick. They have a high acuity. They're gonna develop ulcers, okay? So I'm gonna give them a proton pump inhibitor. Although they're not eating or anything like that, I know that their condition is causing them stress, okay? Somebody who has, let's say they're in nursing school, and they have high amounts of stress. They're in nursing school, they got 2 jobs, they got 5 kids, they got 1 on the way, they got a lot of stress. You know what? I'm just gonna stand like this. Okay? They're gonna have a lot of stress. Sometimes something is gonna work better for them. Okay? Sometimes medications can cause ulcers, like NSAIDs, steroids, okay? I may put them on a proton pump inhibitor, okay? So proton pump inhibitors work a little better than histamine blockers or our Thyssen drugs because they also are really good for those stress ulcers. So you're gonna see a lot of patients that's in the hospital, they're gonna be on a proton pump inhibitor. And you may be looking through their chart like they don't have increased acid, but if you look at their acuity, they're on a whole lot of steroids, or they're like super sick, they're gonna be on a proton pump inhibitor, okay? A lot of times, if the doctor makes somebody NPO, they're gonna be on a proton pump inhibitor. Why?
Because that stress
Me out right there.
But what's another reason?
built up of acid.
They have a buildup of acid. Why?
Because they're not eating.
Because they're not
And they
eating.
gonna be
They're
thinking
NPO.
about eating all day.
And even though they're NPO, they may still think about food. They're gonna see food.
You know what killed me? They'll sit up and watch. They'll sit up and watch the food channels all day, and I'll be like, "Why are you torturing yourself watching this?" I just like to cook at home, and I'll be like, "Baby, you gonna be NPO for the next few days."
Right. Yep. But that will increase the amount of acid that they have. Okay. Questions about the
crazy.
difference between H2 blockers, our Thyssen drugs, versus proton pump inhibitors. Okay, they both are used for increased acid, but proton pump inhibitors, a lot of times we'll see patients in the hospital, even if they have no issues with like increased acid or GERD, you'll see them on that because they're either super sick or they're on medications that may cause ulcers. Make sense? Questions?
Dr. Dykes, look, they found my old man cousin dead today in his work truck.
So, but this was the thing, before then, he was on them goodies really, really hard. And he wound up having a GI bleed. Now, this was like a few months ago, or whatever, like early in the year. Would that have contributed to him, like, after he went to the doctor and got everything checked out, would that still have a reason for it? Because he was saying that he was complaining about his neck and back hurting or whatever. So I was like, well, you think, you know, man, because he's a firefighter. And it was like, you think Dad would still have a lingering effect on his body?
So, did they know what the cause of death was?
No, they just talked to me before I came to school. I really was not gonna come because he was real close or whatever. And, but I told him, man, I gotta go this finals week, so, but.
And his back and neck were hurting?
He was saying his back and neck was hurting, so my man was thinking maybe he had an aneurysm or whatever.
Or maybe a heart attack?
That's what I told him too, or maybe a heart attack. But I was thinking, did it stem from that GI bleed? Because it was horrible, because he fainted like twice.
It
And
could
he
have
was-
been if his blood pressure bottomed out.
And he
Because of
found
the-
him in his work truck.
That's horrible.
Girl.
Then it's hot.
And then it's hot
It's
too.
still as it is outside.
Yes, he a truck driver, so he don't really have to get out and move around, but you're still outside.
And it's hot.
Yes, and it's hot.
No, it was not this hot last year.
Is one of the things.
It
What
was
you gotta
not
forget
this hot
is
last
global
year.
warming. You still gotta remember the ionosphere and all of these holes in the atmosphere.
Outside, like you just in the oven. I don't even go outside, so I gotta come here and work. I work at nighttime now, just so I gotta come out in daytime. If this last
It's so hot at night.
I know, but at least the sun not, you know?
So we said our Thyssen drugs, our histamine 2 blockers, our PPIs, our proton pump inhibitors, which are prazole drugs. What is it going to do to the acid?
Stop it.
Stop it, so it's gonna decrease the amount of acid, right? Then we have antacids. They do not decrease the amount of acid. All it does is it neutralizes it, okay? So it's not gonna decrease the acid, it's gonna neutralize it, okay? So you think that's gonna work fast or slow?
Slow.
It's gonna work fast. Because it's not decreasing anything, it's just neutralizing.
So what that mean, like just to calm it down a little bit?
It's gonna make it, it's gonna change the pH. You ever had a relaxer?
Long time, dirty teeth locks.
So with a relaxer, when it's time for you to wash it, you use a neutralizing shampoo, right? So you can stop the relaxer from working. It changes
Got
the
that
pH.
burn.
Well, yeah, same thing. You're gonna stop the burning. Okay, stop the burning, okay?
Girl,
So
mom used to put us
antacids.
under the dryer after putting that burn meat.
Yes.
You know this abuse.
So antacids is not gonna decrease the amount of acid, it's going to neutralize it, which means it's gonna work fast. So when will somebody take an antacid?
Heartburn.
After they ate the spaghetti, my mama, y'all.
Did she have the pharmacy in her purse?
I know y'all think I'm making it up, but.
We meeting her at the on the last?
You gotta
You gotta bring her.
For real. She could be like,
what she said.
so, yeah, she gonna say, what she said about me.
Ma'am, we know your whole health chart.
So she carries Tums with her. Tums are antacids. Okay, so here's the thing though, every time like you eat, you take it and it works fast because what is it doing? It's neutralizing it right then. It's not, it doesn't have to take time to try to decrease the acid. It neutralizes it right then. Make sense? As opposed to our prazole drugs and our Thyssen drugs, it's gonna take some time. All right, so they may take those in the morning so it can kind of work all day, right? So it can decrease it. This, they take it as needed, okay? But here's the thing about antacids. They may contain some ingredients that may not go well with other medications. So if we look at milk of magnesia, it's got magnesium in there, it's got aluminum, it's got simethicone in there. FYI, simethicone is an anti-gas medication. Okay, you ever heard of Mollicon drops? Yeah. So that's simethicone, it's for gas. All right, but we talked about tetracyclines, right? You can't take it with calcium, magnesium, aluminum. If I look at magnesia, what's in there? Magnesium, aluminum, so they can't take it with that. Okay? If we look at Amphigel, what does it have in there? Aluminum. Can they take that with a tetracycline? No. Then we have, Tums, Rolaids, got calcium carbonate in there. Can they take that with a tetracycline? So we gotta do a lot of patient education, because tetracyclines, antibiotics, it makes your stomach hurt, right? And patients, they don't really realize that Tums and all that kind of stuff is really an antacid. They just know it helps their stomach feel better. So if they're taking an antibiotic and their stomach hurt, what are they more likely to take with it?
Their tongue,
And what's gonna happen with that tetracycline?
it's gonna rock it out.
It's not gonna work.
Oh.
Make sense? All right, let me go back to my. Questions about the difference between histamine blockers, proton pump inhibitors, and antacids? Right, is an antacid going to decrease the amount of acid? No, what is it gonna do?
Neutralize.
Does it do it fast or slow?
Fast.
So when do they usually take it?
In the morning. Or as
Right after
needed.
they eat.
When they have symptoms, when they're eating, when they feel like they need it. As opposed to proton pump inhibitors or H2 blockers, they usually take it in the morning, okay? All right, so with antacids. This is going to detail like I wanted to. Anytime we have calcium, what's the side effect? What is it? Calcium, we usually have what type of side effect?
Stomach,
What kind?
Constipation.
Constipation. Okay, so we know that if somebody's taking an antacid that has calcium in it, they may end up with constipation, okay? Also, they may end up with kidney stones, because calcium, too much calcium can cause kidney stones, okay? Too much calcium can cause kidney stones. If they are taking an antacid that has magnesium in it, what type of side effect would they have? We just talked about magnesium, right? It's gonna have diarrhea, okay? If they have an antacid that has aluminum in it, they're gonna have constipation, all right? So all that matters, okay? So if you got a patient and they're prone to kidney stones, do I want them to have an antacid with calcium in it?
No.
No, because the calcium's gonna make them have more kidney stones, okay? If I have a patient that, they're like a renal patient, they're not, like their kidneys are kind of going bad, I don't want them to have an antacid with magnesium in it. Because it's hard for somebody's kidneys, especially if they're not working, it's hard for kidneys to get that excessive magnesium out. Make sense? So it's better for somebody who has kidney issues to have an antacid with aluminum in it. All right? So again, doctors gotta look at all that, right? So it's not just prescribing medications, they have to look at, okay, how is their kidney function? Do they have kidney stones? Are they prone to constipation? Are they prone to diarrhea? What other medications are they taking? So they gotta take all that into account when they're prescribing medications. Make sense? So what would I tell somebody when they're taking an antacid? What kind of patient education would I give them?
what else are you taking?
What else are you taking? Okay? And so guess what? I said, before I even started talking about all this, I said hydrochloric acid helps us do what? Break down food, right? And what else does it help us do? Absorb medication.
Oh, yeah.
So, anytime I'm changing the amount of acid we have, if I'm lowering the acid, or I'm neutralizing it, what does that mean for other medications?
Not absorbing them as
It's
well.
not gonna be absorbed well. So I usually tell them to take the other medications an hour before they take these medications, or 4 to 6 hours after.
4 to 6 hours.
Because if they take it together, what's gonna happen to the other medications?
They're not gonna do that.
They're not gonna be absorbed. So, let's go back to my mama. Cause she's on all these medications, right? And she's always talking about how they not working. But what is she always popping? Tums. And what is that Tums doing to her acid?
Taking them out.
It's neutralizing it. Why do we need acid?
Okay.
To break down and absorb medication. So she's taking all these medications. And you know what she does? In the morning, she takes them all at one time with her breakfast and takes the Tums. I'm like, you just nullified everything. Like, that's why nothing's working. My pain still, oh mom. You just took the Tums. But they told me to take Tums and my stomach hurt. So what you trying to tell me?
Nothing, you know what, nothing.
So you really gotta educate these patients, especially if they're on a lot of medication. You gotta tell them, take those medications the hour before you take these antacids or these medications that's gonna reduce your acid, or 4 to 6 hours after.
What would be best?
It just depends on how many medications they're taking
And what they're for?
and what they're for. Yep, because even though it says take these other medications an hour before or 4 to 6 hours after antacid, think about other medications. They have interaction with each other as well. So you gotta take all that into consideration.
So somebody would have to actually break down their medication intake.
So when we talked about medication reconciliation, where we're looking at all their medications and stuff, that's the point of that. Not only make sure they have a clear understanding of the medications, just to make sure that they're taking it right, so it's effective. Make sense? So before I went to nursing school, I just thought medicine was medicine. You just take it and you'll get better. I didn't realize that you had to take it at a certain time. You can't take this with that. You gotta take this at this time. I didn't realize all that. So if I didn't realize it, most patients don't realize that either. So whose job is it to educate them?
The doctors, nurses.
So it starts off with the doctor, then it's the nurse, and then the pharmacist is also supposed to assist. Okay? So that's three different times they get an education, as well as that little pamphlet that they get that everybody throws away.
They have to clean off the bag.
Just,
Rip it up.
all right? So with pediatric patients, we usually don't want to give them antacids. Why not?
They live in the bellies.
What else? Huh?
It might make it worse.
So remember with pediatric patients, they have trouble with absorption anyway, right? Because their bodies are immature. So when we give them antacids, they already have issues with absorption. We're just doubling those issues.
So it can mess up like their pH and.
Correct. Huh? Correct. Because when a child says, my stomach hurt, all this is the stomach. And they can't really pinpoint, well, it's actually my pancreas that's bothering me. They can't tell you that. They say, what does it hurt? I don't know, it's just my stomach. The other day, my stomach hurts. Where does it hurt? I don't know. I'm not a good pediatric nurse. I'm sorry, Lloyd. Carry on. Okay, questions? Okay, you can take antacids when you're breastfeeding and pregnant. However, we do not recommend long-term use. Why?
Poor little baby. The little milk will come right back up.
And what else?
I don't know, what else? They don't have enough acid in their stomach?
Again.
Is it gonna
talking about-
cause too much loss of
We
acid?
may have too much of a loss, we're changing that pH. Our pH is supposed to be at a certain level, right?
Mhm.
The problem comes when we have either too much or it's causing some issues. But generally, our pH is supposed to be a certain number, right? When we start messing with that, it's like a ripple effect. Make sense? When our pH is high, they say alkaline is anything above 7, right? So these antacids are going to turn, well, that's something. But antacid is going to change the pH from becoming an acid to like more of a base. All right. Another thing acid does is protect us against bacteria, right? So if we constantly change the pH or we're lowering the acid, what can start developing? Bacteria. Okay,
Now,
because the
stomach?
acid's not killing it, huh?
In the stomach?
Mm-hmm. Okay. And then there's another thing on here that was not mentioned. If we have ulcers it's not necessarily caused by acid, it's caused by bacteria. What are we gonna treat it with? Antibiotics. Sometimes doxycycline, it just depends on what that bacteria is. Okay? But most of the time it is doxycycline. Doxycycline, which is also what class? Falls under what class? Doxycycline.
You didn't give us a rhyme for this one.
Doxycycline, tetracyclines.
Oh.
We just talked about it. Tetracyclines. All right. So we have cytoprotective drugs like sulfurate, and again, Pepto-Bismol again. Is it gonna do anything for the acid? No. All it does is it forms a protective covering over that ulcer. Okay. Especially sulfurate or caraphate. Sometimes it's in like this little chalky type of drink, or it's a pill that kind of turns chalky once you swallow it and stuff. Okay. All it is gonna protect that ulcer. All right. So it's not gonna heal it. It's just gonna provide like protective covering over it, so it can heal. So food doesn't get into it and all that kind of stuff. Make sense? So when would they take these medications? Before eating. Okay? They're gonna take it before eating because this medication is gonna coat the stomach. It's gonna coat those ulcers.
So this would be better than the Tums then?
It just depends. If you don't have ulcers already, then Tums is pretty good. But if you have ulcers already, then you may take Tums and have a coating for the ulcers that are already there. It just depends on how bad those ulcers are. Okay? So what is it designed to do? Nothing for the acid. It's designed to protect those ulcers. Okay? Questions? So again, that's Pepto-Bismol again, as well as sulfurate or caraphate. Okay? And it's pretty safe. We talked about promotility already. Metoclopramide, that's Reglan. Okay? Most of the time that's given for nausea. Questions? Questions? All right, so y'all can take 10 minutes and then y'all can meet me in the computer lab.
Oh, we take it.
Yeah, but I need you to refresh me.
Alright, let's do the ones that we've already done.